therapy, counseling in general. He is a social worker by profession. And I will let Gary talk about his experiences and the brilliant, fantastic work that he does to support people across communities. Gary, welcome to the show.
Thanks, Warisa. Look, you've covered me well. I'm all over the internet. People will find me if they want to find me. I'm a social worker by profession. And all I say I do is I help people to get along and I help people to feel better about themselves. So everything I do is directed towards that.
Brilliant. Sounds fantastic. So when it comes to counseling people, Gary, you take a really unique approach to that. Unlike other counselors who maybe have like several sessions over a period of 40 minutes or 50 minutes, you tend to extend that time. Why is that?
You know, I learned, first of all, I swung into private practice in 1990. And prior to that, all the counseling I had provided for, roughly 8-10 years prior was in an institutional setting that dictated the standard 50-minute hour. Yeah. You get into private counseling and people kept saying, gee, I wish I had more than an hour. I wish I had more time. And I thought, I'm in private practice. There's no rules restricting me apart from those that I impose upon myself. So if you want more time, we can have more time. And from that, it grew. And the referrals that I got were the result of people saying that they could have more time with me. I've long since learned that human problems don't tuck neatly into the standard 50-minute hour.
Oh, yes.
I wouldn't want my surgeon kicking me off the table, saying, we'll take the scalpel out next week. Why do we do that emotionally, psychologically? So as a result, I always set aside a 3-hour chunk of time. No one else does that. A full 3 hours. I bill for actual time used. And then my colleagues tell me, well, if they only take 15 minutes to a half hour, you've got all this time on your hand. I said, well, I'm lucky I have all this time on my hand. I can write reports, I can write articles, I can read, I can do more research, I can say hello to my wife, I can walk our dog. I haven't wanted for an income, quite frankly, using this approach to meeting people's needs. So I always provide a 3-hour chunk of time.
Amazing. And what is the success rate like? What do your clients, people who approach you for seeking help, what is their kind of response like?
Actually, the response is very good. In the knots, I used to do a lot of surveying through letters with clients. So, once a year, I'd send out 50, 60, 70, 80, 100 letters. With stamped self-addressed envelopes, and it'd be a survey. Was I helpful? And if I was helpful, how helpful was I? And then I'd ask, of all the guidance and suggestions that I provided, how much did you actually use? And what I found was I was helpful to about 96% of the people that I met with.
Right.
4% fully not helpful whatsoever. But of that 96%, I was helpful to varying degrees.
Right.
And then I correlated that to how much of my feedback or guidance, because I do provide feedback and guidance. Many counselors don't. I do. So I asked, relative to the guidance provided, how much did you follow through with? And it was an interesting correlation. Those that followed through with, most of the guidance tended to do much better than those that followed through with little. It's no surprise. Go to your doctor. The doctor says, here, take this or do this. Typically, we get better. You go to your doctor says, here, do this, do that. We don't follow the advice. We do everything as we were doing before. You walk out with what you walked in with. So by listening, by providing ample time, so it takes the anxiety out of the session for having to squeeze everything in, and by providing guidance, by making connections for people that many counselors wait for people to make on their own through the process. I think, well, why wait 10 sessions if I can just tell you? So I tell you.
Mm.
So because of that, people, in my experience with me, feel relief sooner and better. Not for
And that's,
everyone,
yeah,
but yes, for many.
yeah, yeah. Do people feel overwhelmed? Do they feel that this is too long, 3 hours? What are we going to talk about? Or do they feel, no, this is good. I can talk about everything.
Excellent question. And it's interesting because many people enter into the process with me thinking,
Mm.
what the heck are we going to talk about for 3 hours?
Yeah,
And that it is a long time. And honestly, well, first of all, we don't need to fill the space just because we have it.
yeah,
Okay. So if we're only an hour or 2 hours, so be it. But it's not uncommon to fill the space. And even when we do, people's experience is more aligned that they can't believe how fast the time flew. It just
yeah.
goes like that because we're engaged in a conversation. And it's not this person sitting there for 3 hours talking at me. I
Yes.
actually ask a lot of questions.
Mm.
Many therapists' approach is to sit back and
And just
listen
listen.
week after
Yeah.
week after week. As they're listening, they are taking notes. And from that,
Mm.
they're gathering the tidbits of data that is important for them to come to a hypothesis, and then maybe down the road offer some tidbits of guidance and or advice if they even do. But
Mm-hmm.
because I'm going to ask about one's family of origin, one's ethnicity, one's culture, and depending
Yeah.
on the country that you're growing up in, what is that like? Here in Canada,
Yeah.
we have a large immigrant population. What
Yes.
was that experience like? What was it like for your parents? There's a difference if you're an immigrant to Canada versus first generation, second generation. What is that like? What do those differences create within your family? I
Mm-hmm.
ask questions about abuse. Is there yelling and
Mm.
screaming? Is there any shouting? Is there any swearing? Is there,
Yeah.
and when people say that they're swearing, I'll ask specifics. What are the words people use?
Mm.
And I'm doing that not to shame or embarrass.
Yeah.
It's just that there's a difference between some words and other words. It speaks to the intensity.
Yes.
So I ask about that. I ask about, do people throw things in your house? Slam doors? Any pushing and shoving? Is there ever a Cold War? Some people think that if there isn't yelling and screaming, there isn't abuse.
Yeah. Yes.
A Cold War is emotionally, psychologically abusive.
Yes. Neglect.
Oh my goodness. Or that intensity of silence.
Not
Um,
communicating. Um, Not making any physical
So
contact.
I'm
That's.
curious about all of that. I'm curious about alcohol consumption,
Mm.
drug use.
Yeah.
And so I literally ask these questions. Sexual abuse. I
Yeah.
ask, have you ever been touched in a way that's made you feel uncomfortable? I ask all the questions. Here's the thing. In traditional counseling, there's a
Mm.
belief that as we form the relationship, people will get more comfortable disclosing some of
Mm.
the more embarrassing, shameful, difficult, scary parts of their life.
Yeah.
The truth is, you can get as comfortable as you want with someone. You still may never disclose that information.
Yes.
So I'm comfortable in my skin,
Mm.
so I can ask. And
Yeah.
by asking, it says I'm comfortable, and I'm now giving you permission to speak to this.
Yeah.
And so it's not uncommon for folks to say to me, wow, you're the first person I've ever told about whatever it is.
Yes.
And I thank them graciously. And now we know what we're dealing with.
Yeah.
Now we know what's been locked in. And we can address it so forthrightly, non-judgmentally, but openly.
You tend to do a lot of work with families.
Mm-hmm.
And how does that work? Do individuals approach you and they talk to you and then you explore what's happening in the household and then you kind of include other family members, or do they just come to you and they're like, okay, this is happening and I don't know what to do?
Um, it's been a bit of a journey for me in terms of my approach and why I do what I do. I was trained in the early 80s as a family therapist. So I was trained in what we call systemic family therapy broadly, and then more specifically, structural and strategic family therapy. And then I realized I'm not getting things. So then feminist approaches to family therapy, and it's like, oh my goodness, let's look at these power structures and power dynamics versus hierarchical or, who's doing what to whom.
Yeah.
That opened up my eyes. I was at a children's mental health center where we were working with a lot of inner city Black youth, and we had an abysmal success record, abysmal. And in the wisdom of our executive director, he hired a Black psychologist, which was unheard of at the time.
Wow,
I'm
back in
talking mid 80s, right?
Yeah.
Unheard of. So Delroy Loudon, he came in, this lovely Black Jamaican psychologist, and he did a couple of things. He joined this white guy in every first session, and he told people that, and I'm thinking, oh my, this is so contrary to what I'm trained in family therapy. But he's pointing fingers at them in this beautiful Jamaican accent saying, you got to listen to Mr. Direnfeld. You do as he say. You don't do as he say, he gonna tell me, and I'm gonna come speak to you.
Yeah.
I couldn't do that. But he could do that and come in a sense, do a laying of hands that gives me authority in this context culturally.
Yeah.
That was an eye-opener. The other thing he taught us was the concept of the obia man. I don't do a good Jamaican accent, so I don't want to appear disrespectful by doing it, but I hear his voice as I speak about this. So the obia man is the tribal elder, the wise man of the community to whom people would turn. And so he would come in as the obia man. He would do the laying of hands, and therefore we're working with his permission. But I took that concept into my work. So I'm Jewish. When I was working with Jewish families who wouldn't listen to me, I'd bring their rabbi in.
Yeah.
Son of a gun. I've brought an imam in when working with Muslims. I've brought priests and ministers in. I've brought accountants in.
Yeah.
Because you sit back and you say, who in this person's community, in this person's pond, in this person's realm, who do they respect? Who are they going to listen to? I brought Indigenous elders in. So my approach to family therapy over the years has grown. I get a lot of referrals for parents of children. See my child, see my child, see my child, see my child, see my child. Very often the issues of the child are those befalling them from the parents.
Oh, yes.
The yelling and screaming in the home, the parents not necessarily knowing how to manage an issue of the child. Neglect. And it doesn't have to be abuse and neglect on a nuclear scale. It could be, sometimes subtle and whatnot. So if we bring the child in too soon, ahead of those parents, typically you have sitting in front of you someone with their arms folded, you can't make me talk.
Yeah.
Or they're spewing stuff about their parents. They hate their parents. I won't know what's going on. Anyways, rather than seeing kids first, I always meet with parents first. No child can give me their own developmental history.
Yes.
No child can give me what I can see between, both parents sitting in front of me. I don't meet with one. I meet with them both, typically together, unless I screen for domestic violence and power imbalances.
Yeah.
Sometimes it can be so severe, you do not want both parents sitting in front of you simultaneously. It's not safe. But assuming I've screened for that and it is safe, I'll have both parents sitting in front of me. And so I've learned that with respect to working with children and family therapy, I personally like to start by meeting with the parents first, getting their own family life stories, all those questions that I've mentioned I ask about. And I ask how they're getting along, how they're managing the issues of the child. It's really common that one parent wants to do this with respect to a child's behavior and one parent wants to do that.
Yeah.
And then the child somehow or other comes up the middle and escapes both.
And you can see where the conflict is, where the problem is, why the child is behaving in this way. Yeah.
Yes. And sometimes by meeting with the parents, I may sit back and think, they're on the same page. They're saying the same things, which is also good. And it may be that this child has an actual condition.
Mm-hmm.
And so I may hear the symptoms of an auditory processing disorder. I may hear the symptoms of attention deficit hyperactivity disorder. Yeah. And so rather than my seeing and counseling a child in the absence of knowing these things for sure, on the basis of having met with the parents, I'll suggest to them, let's get your child assessed for this first. Let's figure out if we're dealing with that, because it makes such a difference in terms of how one counsels those parents to deal with that and the child as well. So there's many reasons that whenever a parent calls me on a child-related matter, I meet with the parents first. Yeah. And then if I'm going to meet with the child, I include the parents in that meeting so that they see firsthand what I'm asking, what we're talking about. Many parents worry that the child won't open up. Yeah. In my experience, as long as the parents remain quiet and I coach them about how to conduct themselves when I'm talking with their child. And so assuming the parents allow me and don't interrupt and don't coach the child themselves, go ahead, talk to Gary. That shuts them down. It's rare that a child doesn't open up. And then the parent gets the benefit of hearing the conversation and learning of the child's issues. Some folks have said to me, but what if those parents actually are abusive?
I was thinking about that. Yeah.
Right?
Then the child will feel so intimidated and fearful of saying anything.
Well, if that is a concern of mine, I likely will have sussed that out through my interview of the parents first over the course of 3 hours. How do you guys get along? Any yelling or shouting? Any name calling? Any Cold War? Who drinks how much? How do you feel when that one is drinking?
Will they admit to that? Will they say, yes, I'm the one who is aggressive or I'm the one who has issues?
Warisa, sometimes behavior speaks louder than words.
True.
So there can be a darting glance. There can be a look away. And there can be a withdrawal. There can be a halt. And so we notice those things. And we comment and say, I see that when I asked this question, you jumped in really fast and you kind of sat back. What's going on? Okay, so I comment on behavior, not just content that people deliver. And if there is a mismatch between the content and the behavior, I'll share with them my concerns. And so sometimes it's not appropriate to bring the child into that setting. You're right. We work with the parents then, recognizing it is these issues that are befalling the child. And if we address that, it releases the child.
You have done a lot of work around custody and access recommendations, parenting plans, child development, and child relationships.
Yep.
Tell us about that. Tell our viewers what kind of problems you come across on a regular basis, and the most common ones.
Oh my goodness. I don't know if there are most common ones. The result of gray hair and having been in the field for so many years, again, you gain experience and you gain a reputation. One of the reputations I have gained over the years has been a willingness to work with folks who are what we call in high conflict.
Right.
When we talk about high conflict separated parents, some of the indicators of that are very divergent views of what's happening, the rigidity with those views. Everything becomes a dispute. There may be child protection agency involvement. There may have been police involvement. This matter is likely before the court system as a means to resolve the dispute. We often see very strong lawyers representing these persons as well. So a lot of my work over the years has involved folks in high conflict separations. So one's practice kind of determines what one sees. So when you say what is most common, that's actually not very common. That is 3 to 5 to 6% of separating parents. But much of my practice has rested on that. So it feels almost like everybody's this way. And I have to remind myself, no, it's a small percentage of the population. I used to do a lot of work with parents involved in the family court system. So I would be the evaluator or assessor offering recommendations to the court. And people also used to be able to hire me as a private judge, an arbitrator. Those are actually two services I stopped delivering in about 2015. And the reason for that is over the decades, people have gotten a lot nastier. It used to be if somebody didn't like the outcome, they'd still shake our hand, say thank you, and move on. With each successive decade, there's a greater likelihood that a disgruntled parent will look to sue the service provider, complain to our regulatory body, write nasty things on the internet about us, and even harass us to the point of needing police protection. And I've been through all of that. So that's why I stopped working in offering those particular services, although I still work with folks in high conflict situations. But now I've chosen to do so only through means we call peacemaking. Peacemaking includes things like collaborative family law, mediation, coaching, and counseling. Collaborative family law is an approach to conflict resolution that still involves lawyers, but the lawyers agree they're not going to court. We will sit round table, we will hash it out, and we will come to a resolution, but we're not going to ramp up your conflict by saying you're a this and you're a that and holding rigidly to that. Rather, we're going to say, what do we need to do differently in order to move forward? The beauty of something called collaborative family law, and you have it in the UK as well. It's an international movement. It started in the city of Minneapolis, Minnesota, by a man by the name of Stu Webb in, I think it was 1990. This guy just turned 90 years old yesterday or today, as a matter of fact. Fabulous, fabulous fellow. He spawned this movement. Anyways, the beauty of this approach is if we reach a roadblock, we can bring other professionals to the table. We can bring counselors, we can bring social workers, we can bring financial professionals to help sort out what are your holdings. Two cannot live as cheaply as one. How are you going to survive? So that we can deal with all the fears, all the issues in a safe space. So collaborative family law and mediation, you're going to meet with a single neutral person to help keep the discussion hopefully civil and on track to resolve your dispute. And I do a lot of coaching. So I mentioned coaching. And that's where I'll meet with one parent subject to the dispute and literally teach how to manage oneself in the context of these stressful situations. It's very common. People get worked up, they lose their own calm, they come across harshly, that's met with defensive and aggressive behavior, or they may get overwhelmed and they may go
Yes.
into fear, flight, or freeze mode. So through coaching, it's to facilitate the development of these strategies to cope more successfully and to present your better self. And then counseling is sometimes, let's figure out who the heck you are and where you want to go with this, so that when you enter into a dispute resolution process, you have a better sense of what it is you're trying to achieve. So, Gary, go ahead.
Yeah. One of the things I wanted you to talk about is the book. It's about relationships, marriage rescue, overcoming the 10 deadly sins and failing relationships, and raising kids without raising Cain. That is such a powerful title in itself. What is it all about?
So there's a backstory to this. The backstory is I dropped out of high school. I did not finish here in Canada back in the day, grade 13, which enabled us to go to university. I dropped out with my grade 12. I returned to university as what we call a mature student. And that is someone who has their grade 12 and is 21 years of age.
Yeah.
Within my first year, I was getting my essays back, and there'd be a bright red D, and you have a serious writing problem. And I went to the professor. I said, okay, I mean, I know I can't write, and you've caught me. What do I do about it? I learned then and there that if there's something I don't know, ask. And I learned that teachers and professors are such wonderful people. They live for the success of the student. So in going to a couple professors in particular, they gave me such wonderful guidance. The guidance from one was, Gary, your essays are one run-on sentence. That's not an essay. It's not even a paragraph. It's not even a sentence. So, well, what do I do? And he said, read Ernest Hemingway. Really? He said, yeah. I said, well, I actually didn't enjoy reading. I don't want to read novels. And he said, well, get the anthology of short stories. Okay, because that way I can read 2 pages, story done, next. The reason he wanted me to read Hemingway is because Hemingway wrote in small sentences and few sentences per paragraph. And all he said was, read this, copy his style. I did that.
Wow.
As a result, I got through university, and I never got an A, by the way. I was a strong B+ student. And since then, I've written 2 books and several thousand articles.
That's amazing.
So the first book, Raising Kids Without Raising Cain, which you can just download from my website, yoursocialworker.com. It's a short book. I was doing workshops in the 1990s by that title, Raising Kids Without Raising Cain. And people kept saying, have you written a book? Have you written a book? And I just sat back and I took the content that I used in my workshops and I wrote the book. It is a short book, 50, 60 pages. You'll read it in less than 45 minutes. And it gives parents some general concepts to, right from the get-go, improve their parenting.
Wow.
The next book, Marriage Rescue, Overcoming 10 Deadly Sins and Failing Relationships, that came as a result of a television show that I hosted here in Canada. I was approached by a producer. We're doing another reality show, and the title is Newlywed, Nearly Dead. We're looking for a counselor host. So I did a video thing, and they tested, the screen test. I passed. And that show ran for 65 episodes here in Canada.
Wow,
on the Science Channel.
That's amazing.
As a result of that, I was approached to write a book. And so I wrote this book, Marriage Rescue, Overcoming 10 Deadly Sins and Failing Relationships, where I just go over some of the 10 big issues that a lot of married couples face when they come to me. And, I just talk from my experience, and I use examples from folks that I've met with in terms of what they do, what they shouldn't do, and what they can do better. But, you think, wow, TV show, author, there's a joke, and it goes like this. What's the difference between a Canadian author or a television star and a large pizza? A large pizza will feed a family of 4.
Wow. That's a good one.
We don't get rich off these books or a television show here in Canada, but I have been there, done that. I continue to write. I'm on Facebook. I have about 17,500 followers there. I post 2 to 3 to 4 mini articles daily. And they're all from the heart, quite frankly. And they're all.
And this is someone who once upon a time couldn't write.
Right? Exactly.
So miracles happen, right? There's always hope. You shouldn't give up.
Well, and I'm transparent about that. I want people to know that. People see me as, oh, you're so successful. You've done this, that, and the other. You know what? There isn't any of us who haven't had to climb some sort of ladder. The only difference is if you know about the other person's ladder that they've had to climb. And I've certainly had to climb my own, and others as well. You and I, we're born human first.
Of course, yeah. Another thing I wanted to discuss with you, I mean, there are so many issues that we could have covered, but because we're talking about family relationships and conflict and extreme behaviors, I want you to help our viewers understand what someone with a borderline personality looks like. Because there are so many myths around this. People believe that this is some kind of a personality that people carry with themselves all the time. If you could just shed some light on that would be just fantastic.
When we talk about a borderline personality, we're talking about a psychiatric diagnosis where we're speaking to the manner in which a person sees the world. And the manner in which they see the world is different, is skewed from how most people would see the world. When we see the world in a way that is skewed from how most others see the world, we may say that person has a personality disorder. And then when we see that there are certain features that kind of glom together, and there are people who see the world this way, this way, this way, but all different from the majority of people who see it realistically, we say you have this kind of personality disorder or that kind of personality. So borderline personality disorder isn't about, oh, you almost have a personality. It's not borderline in that sense. It's that the way in which you see the world is somewhat fractured.
Right.
And because this is your normal, you don't recognize it in yourself. Like right now, I'm looking to you through these lenses. And for the most part of my life, I forget that I have these lenses. This becomes my normal. I take them off. You're very blurry to me right now. It's that, oh yeah, I wear glasses. So when you have this personality disorder, you're looking at the world through your own lenses. It is your normal. You don't realize you're wearing them. So what is it about a borderline personality? These are persons who have tremendous difficulty trusting in another. These are persons who look at the world, who look at others and say, they may be for me, they may not be for me. There's a kind of binary to it. You're either for me or against me.
Yeah.
And that binary can actually shift moment to moment. So one time you're close, you're near, things are, oh, we've got the best relationship ever. You look at me askance one moment, I think, do they really like me? Has something happened? Is there been and with this binary, I shift so far the other direction. I think, well, if they're not going to like me, I better not like them first. And we jump on this. And so with this kind of personality disorder, it makes having stable relationships really difficult.
What should you look out for? What should you look out for? What are the signs, like the classic pattern that you get to see in someone who is suffering from a borderline personality disorder?
This kind of all or none thinking, this black and white, you're either for me or against me. These are folks also who are very, I'm trying to find the right word. I'm always measuring my words. I'm going to go with triggered for the moment.
Okay.
Or sensitive to. These are folks who are very sensitive to concerns of abandonment. Am I going to be left behind? Are you there for me? Are we connected or not? And so that can come out in behavior. I want to speak for a moment, though, to where this comes from and then what you can think about it. We tend to see this as being socially mediated. In other words, you're not necessarily born with a borderline personality disorder. It tends to be more of an outcome of one's upbringing. And when we say upbringing, we're typically looking at the first 3 to 4 to 5 years of life.
Okay.
So imagine this child is born. This is sign language for birth. It's very graphic, so it's not just me. That is the sign for birth. This child is born, and the child goes wah. The parent hears the wah and seeks to soothe the child. First thing most parents do, they turn the child over and they sniff the child's bum. Is it a poopy diaper? Right? Because it's the easiest and quickest thing you could do. Not a poopy diaper. Then the parent seeks to feed the child. So whether it's breast or bottle, the child takes it, quick. The child doesn't, child's still going, wow, it isn't the poopy diaper. It isn't feeding. We pick the child up, we go, and the child soothes. So the child's experience of this is they signal distress, we respond, they are soothed. That's not every child's experience.
Right.
Child is born, child goes wah, parent doesn't even show up. Child goes wah wah, nothing. Wah 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 wah, nothing. Wah wah wah, right? Nothing. Yeah. This is a child who over time learns not to call out. So I'll sit here.
Because they learn that their needs are not going to be met anyway. So what's the point?
Yes. And those are children that can grow into depressive situations. Things just happen to me and I have no agency. I have no one who will come to support me. This is just the way it is. So they develop that worldview. There's a third scenario. There's many more, and we're condensing to 3.
Yeah.
Child is born, child goes wah, and sometimes the parent is there very responsively. Sometimes the parent is not there. And on other times still, the parent goes, what are you doing? Sorry if I'm scaring anyone, but imagine that child. What are you doing? And whack, hits the child. Now the child doesn't know what to expect.
Yes.
Are you the source of my comfort? Are you providing any comfort whatsoever? Or might you also be the source of my distress? And so this is a child who has to grow up with spidey sense, forever scanning their environment, and the parent needing to know, is it safe? Can I come forward? If I do this, will you be there? Or will you reject me? Follow the trajectory of that. I'm now a young adult. My partner comes home late from work.
Mm-hmm.
I'm secure because my needs have been met. I
Yeah.
don't worry about others. Partner comes home late from work. I say to partner, you're home late from work. Is everything okay? And
Mm-hmm.
partner says, well, the traffic was awful, but I'm
Yeah.
good. Great, let's carry on.
Yeah.
Second scenario, partner comes home late from work and the person, oh, you're late from work. Well, don't you care? Well,
Mm.
oh, okay, I guess I care, but no one's ever responded. I haven't learned to respond. This third scenario, person comes home late from work, you're late.
Yeah.
Well, the traffic was bad. How do I know?
Mm-hmm.
This is more of a borderline
Yeah.
personality style representation, but we can trace this back to
Childhood.
experiences in this early childhood.
Mm-hmm.
So this is how we come to understand this. Our job is not to blame the person who does this. We want to understand. From there, we have to go to treatment. How do we
Yeah.
help you? There was a woman in the 90s. Oh my goodness, her name escapes me, but she developed something called dialectical behavior therapy, DBT, not to be confused with CBT, cognitive
Mm-hmm.
behavioral therapy.
Yeah.
Cognitive behavioral therapy is I'm going to change how I think, and that will affect, how I do. In dialectical behavior therapy, I'm going to consider how I come across and how you come across, and I'm going to give myself the space to self-reflect, figure it out, generate some responses, choose the right response, and enact it. So dialectical behavior therapy involves mindfulness, learning to self-reflect, learning to recognize one's emotional state so that one isn't held hostage and acts, in a sense, knee-jerk from it.
Yeah.
So, when we talk about borderline personality disorder, it is one of the scariest diagnoses to use, to receive. But once we understand it in this broader context and realize that there is a therapeutic approach targeted specifically to that, it's helpful to a good many people.
You mentioned it's a psychiatric disorder. Does that mean that the person who is suffering from BPD will be totally dependent on medications, or is it something that they will use alongside therapy?
Well, it's interesting. This is not a disorder that lends itself to treatment with medication.
Right.
Depression does, anxiety does, psychotic psychiatric diagnoses lend itself to medication. There isn't a medication specifically for borderline personality disorder because this is a way of how we see the world. However, it's not uncommon that if you have a borderline personality disorder, you may have another disorder at the same time, one of mood. If your life isn't working out, you're in conflict everywhere and things are falling apart, you may be depressed.
Yeah.
If you're worried about what's going to happen next, you may be anxious. So it's not either or. Sometimes disorders are that and. From that perspective, a medication to treat the depressive component or the anxiety component can be very helpful. And the particular value of treating those components with medication is that as that settles down, it allows you to concentrate on this other dialectical behavior therapy, this other form of talk therapy. Yeah.
So is that where the insecurities and the fear of abandonment originates from? What you experienced in your childhood, and then it just comes out as you
Yes.
grow older, and
I
then it
can't
affects.
trust that parent is there for me in a stable, healthy, wholesome way. Sometimes they are, sometimes they're not. And listen, I want to be careful about talking about this. We're not necessarily talking about bad parents. There are other things that can create these issues. You may have a parent with a drug or alcohol problem, and the
Mm-hmm.
result of their consumption, sometimes they're there for you, sometimes they're not there for you. They may have their own mental health problems. Sometimes
Yeah.
they're there for you, sometimes they're not there for you. We have parents who live in war-torn countries,
Yes.
in situations of abuse. And so sometimes my attention is reasonably distracted from the needs of the child versus what I have to cope with in my life. But these things can still create the conditions for the child where they don't know if you're there for me, not there for me, if it's safe for me, if it's not safe for me. So we do have to understand what went on, what this child's experience was early in their life to figure out this trajectory and then how to shift the trajectory.
So apart from feeling insecure or having extreme outbursts of emotions or extreme responses or reactions to other people's behavior and attitude, what else do they show in terms of the behavior?
Well, as you were saying, these extreme reactions. So there's a challenge with emotional regulation. And fancy dancy term, it just means a challenge keeping your cool. Right? I like to talk in this. People can understand keeping your cool. What the hell is emotional dysregulation? So these are folks, again, who can benefit from things like meditation. I learned meditation when I was 21 years old. I've been practicing, not continuously, but off and on for all of my adult life. And I've even dabbled and practiced in other forms of medication. As you and I are talking, you notice that I'm able to measure my words. My shoulders have been down literally the whole time. I'm breathing from my belly versus, oh, and then, right? So these are all strategies that help keep us centered in our bodies so that we can be more calm. And so these are strategies also that are helpful to the person who may have a borderline personality disorder, or who, forget the disorder. Some people are just more excitable. They can overwhelm others by virtue of that. This helps bring you down a bit so that you don't overwhelm those with whom you're trying to have a relationship.
Gary, I would love to continue this discussion, but unfortunately we have run out of time and we have to end the show.
This is what happens. Even a 3-hour meeting, it goes so quickly when we're engaged.
Yes. Well, I wish I could have a 3-hour session, but unfortunately we can't. But we would love to have you back on the show once again. And once again, thank you so much, Gary, for taking the time out.
Give me a second here. I so appreciated meeting with you. You took a risk from across the pond. You clicked on LinkedIn and you said, hey, would you do a show with me? I don't know you from anyone, right? And I just said, sure, let's sort it out. And within a week, here we are. So thank you for taking your risk.
No, it was worth it, every minute of it. And I really look forward to seeing you again, Gary. And to all our viewers, thank you so much for joining us. Thank you for watching this show. If you have any questions, feedback, or comments that you would like to share with Gary, you can either call in our studio or leave your comments on our Facebook and YouTube Hidayat TV's page. Meet you, inshallah, next Saturday with another brilliant guest and an amazing topic. Till then, look after your mental health. Assalamu alaikum wa rahmatullahi wa barakatuh.